and sorry for starting late. And I'm happy that Dr. Chavez started the precedence of being off the stage because I'm going to be off the stage. So, my name is Dr. Abdelbary. I'm going to be presenting today developing effective IPE facilitators. And these are learning objectives. So we're going to discuss strategies for effective in-person and online facilitation. And that's most of the presentation. I'm going to be focusing on that. And then we're going to touch a little bit on assessments and again, barriers and how can we deal with barriers, and then how to define and include DEI. So I'm going to start by something off topic a bit, but it's important and was mentioned in today's morning keynote speaker, Dr. Deepa's presentation, which is psychological safety. What is psychological safety? So psychological safety is how much do you feel safe in your learning environment, in your collaborating, practicing environment? Do you feel you're heard? Do you feel that you can speak up and mention something that's, oh, this is going wrong, or you're going to be scared and afraid and keep it to yourself? When learners have psychological safety, that's actually promote learning and as well as help in the IPE collaboration. Everybody should be heard. Everybody should feel safe that it's okay to speak up. It's okay to express their voice. When learners have psychological safety provided, that's when they perform best. So again, we can tell learners that, oh, it is psychologically safe, this is blah, 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 even in the classroom outside of IPE, but do we really model it? Do we really accept and respect opinions expressed by our student learners, right? So we can share the belief that we have psychological safety, but we have to model it as well. So we have to recognize every team member in our IPE group. We have to value them, and we have to thank them for contribution and highlight the role in the patient care, okay? So usually we don't want people to be in their comfort zone either with high psychological safety and low expectation, but the best thing is to have high psychological safety and high performance standards as well, where our students should fall into that green zone or psychologically safe learning zone. We definitely don't want the red zone, and we don't want as well the comfort zone. So how to create psychologically safe. So we need to frame the work, why we're doing this, why we're doing the activity, why we are promoting IPE, why we want you to work together, right? We want to set expectations about failure. Failure is not bad. We are in a learning environment, right? If you do a mistake in your IP activity, caring for a patient, it's fine. We're all learning and preventing actually that mistake from happening when we're actually taking care of a patient. So it's okay to make a mistake. We can all make mistakes. As facilitators, we can give examples when we had our trips and, during our learning journey as well. Coaching is another point. Facilitators and instructors, faculty needs to be coaching oriented. You are actually helping your students move, grow, not just learn. So what is facilitation? So facilitation is actually a process of helping a group of individuals to work together. Okay, so you're empowering those individuals to do the work. You're not doing the work for them. So facilitation is not teaching, is not you're standing in the room with the group and telling them what to do, rather than how to do it and let them think about it, bring what's inside, give other ideas, share, and do it on their own. So again, facilitator is not a teacher. Also, a facilitator does not have to be an expert in the topic matter. You don't need to be an expert to be a facilitator for this case in particular, because again, you're using the expertise of your group of learners, which should cover all the like the people needed to be involved in the case for the patient, right? Or solving the problem. So effective facilitators actually should have good communication skills, flexible, patient, because you'll have to deal with some conflicts that can arise, confident, open-minded, okay? And also they can work fast with uncertainty that can arise. And again, we're not teachers, we're just helping the group what they have from their expertise areas. So what is the roles and the responsibility of the facilitator? So again, articulate group discussions, setting rules. So at the beginning of the activity, I'm going to set some rules. For example, for my group, this is what we're going to do. This is the goal of the activity. This is what we should do. This is what we should not do. So highlight rules. Okay. Encourage, coach, support, observe verbal and nonverbal cues within the group. What if one of the group members does not participate? So quiet. Are we supposed to leave them non-participating? Or are we supposed to find other ways to encourage them or bring them in the group discussion? So that's a role of the facilitator as well. Ensure that all the disciplines are participating equally, okay? And we should not, as a facilitator, I should not be favoring my discipline over other disciplines. So for example, I'm from the medicine side and I'm facilitating a case where I have a social work student, a nursing student, a PE student, a med student, maybe athletic trainer, okay? I should not be favoring one student over the other or one discipline over the other, specifically if I know personally one of the students in the group because he is my student. So, throwing questions here and there to make them critically think, okay? Not necessarily that they are going off track of the case they are working with, but maybe making them look deeper into things that they are missing, but not giving them answers as well, okay? So probing the reasoning, again, challenge their thinking, and again, making sure that the discussion is moving within the activity in the right direction. They are not getting distracted or going overboard or maybe chit-chatting or something like that. So again, facilitators should listen rather than talk, right? Observe and not teach, and then guide. So some techniques or strategies that can be used. Okay, first of all, establishing your role. So at the beginning of the activity, a facilitator should establish the role. That's what I'm going to do. Don't expect me to do this, but expect me to do this. Checking your biases. And by the way, we all have biases, whether we know it or not, and whether we like it or not. So one of the things I actually teach to my students, aside from IPE, is that they have to know their bias if they are in healthcare. If you are dealing with a patient in any capacity, you have to know your bias. There's many tools online that actually you can know your biases. The IAT is the most kind of famous one with Harvard. You can just do it online, you know your bias. And it might not change the bias that you have, but just being aware of the bias will help you to kind of try to dodge it, okay? If you feel that you have it. Same thing here. The facilitator should check their bias, whether against a discipline, a person, or whatever, but we should all put this aside. Valuing all experiences in my room, in my group, and talking about this. No one can care for a patient alone. No discipline can care for a patient alone. We have to all work together. And emphasizing that, again, this is not just an education activity that we're doing. This is for the goal end, which is caring for a patient, and how much working in a group can actually affect the patient care. So that's something that you need to emphasize on. Power and hierarchy, right? Who is the leader? Who's the boss in the team? That's a very good question. And I guess everybody can think that we're the leaders, right? So over there, you're the leader, I think, right? You're doing this. So what's your discipline? Counseling. So what do you think you're the leader? You want to take charge. Okay. So actually, it depends really on the patient case. You know, some case the leader might be the counselor, the psych, you know, the LPC or the psych, the behavioral area. In some other cases, maybe the leader can be from another discipline. But it's much better, thank you. So it depends, but there's no set rule who should be the leader. Again, I'm coming from the medicine side, and we have this pre-idea in mind that the physician should be the leader, which is not true all the time, but they have to come to that consensus, okay? So power is a problem. Who's the leader is a problem, but we have in our activities and in our work as teams to emphasize nobody is the boss. We're all working together. It's a team, okay? So having a parking lot for the conversation goes off track. So let's say one of my participant has these off track questions. We can come and the facilitator can always come and say, hey, we're gonna put this and discuss it later. So that's kind of the parking lot idea. So no stereotyping, okay, and value all ideas presented again by the different students. What to do as a facilitator? Okay, impose your opinion. Oh, no. This is what you should do. This is what's right. I'm telling you what to do. That's, by the way, in any field, the right approach. Downplaying people's idea. Oh, no, they're just a, you know, dietitian, what they know other than that. That's very bad. So again, and I am not hitting on anyone or dietitian to my mind, okay? So downplaying people's idea is really not the way to do it either. Dominating the group. We said we're not teaching, we're facilitating. So should we be really actively involved in the activity or just coaching the students who should be solely involved in the activity? So that's one thing. Making answers. So if as a facilitator, we said that facilitators should not be to be expert topic matter, right? So if they don't need to be expert topic matter and they got this question that they have no clue about, please don't make answers, okay? You can acknowledge basically that you don't know. And you can invite other participants to give their opinion and answers. That would be more of a collaborative, modeling collaboration rather than just giving wrong answers. So IPE in particular, facilitation for IPE might be different than general facilitation, okay? It's more complex, demanding. Why? So is it easier to facilitate a group who are working within similar disciplines or facilitating group of people or activity that are really wide, broad? Like, let's say we are, you know how many healthcare professionals are there? How many? We're always focused on nursing, med student, PAs, you know, but there is a whole bunch of other professionals that will be considered actually under healthcare professionals, like athletic trainers. Like, so there's a whole bunch of variety that you as a facilitator or me as a facilitator might not even know what is exactly their role. right? So in this case, I have to actually ask them to clarify, present yourself and clarify what would be your role, not just in this activity, but generally in management of the patient care, okay? Unique skills are needed, again, for the IPE challenges. And some of the IPE unique challenges is using of discipline-specific language or jargon, right? So, okay, this should be in the rules that no specific language to be used, but what if one of your learners decided to use a specific language? As a facilitator, you can always remind them that this is not allowed, but also you need to ask them to define the word that they just mentioned, and you know, so can understand, and then you can say, if you use it again, I'll let language and let's see how we can communicate, because they need to understand that's about communication, right? Again, different conflicting expertise. So I have these two learners with different backgrounds, and now they are conflicting, their opinions are conflicting. We need to work on resolving that and maybe ask them to explain more and come to a consensus, okay? Participants at different level stages in their program, and I actually have seen this hands-on here in the college and some of the activities that we had. So we had MSs, we had second-year PA students and third-year nursing students, and there was your over, you know, wide range of expertise, experiences, knowledge. That's something that we have to, in the planning, to pay attention to. Again, difficulty transferring knowledge from one field to another. If I don't understand what you do, how can I understand your opinion on the case or what you want to do with the patient, right? So would that require clarification originally of your role? Yes, and then for me to buy in to your opinion, right? So additional skills that I might need, or any facilitator might need, is, again, highlighting the process. So ensuring that everyone on the team trust each other, respect each other, know. So again, start by introducing, who are you? What is your role in the patient care? What can you do for any patient? Okay. And then what is your perception about the one sitting next to you and their role in the patient care? Always link the discussions and the learning activities to practice. So this is how, you know, when we go out there in the field after we graduate and work in teams, that's how we make a difference in the patient life. Okay, so include everyone's perspectives. Nobody should be left out. Nobody should be left out within the group of learners. Then we come to online facilitation, and we took COVID and things were like all over the place. And online facilitation is much harder, because if the introvert in the room will not talk, will they talk online? No way, right? So making sure that everybody participates, making sure that you can fly blindly, meaning is face-to-face, you have, you know, body language, you have this, you have these, all little things that you can use to help your facilitation. But online, oh, you're losing all of these 5 senses, right, that can help you. So you're kind of flying blind. Don't let technology overwhelm you. So keep the activity online simple, okay? Be explicit about guidelines of communication, whether asynchronous, like, you know, netiquette guidelines, or synchronous. Again, we should have communication guidelines. Like, for example, oh, don't bombard the chat with weird words and stuff like that. So again, guidelines should be highlighted. And we need to make sure that we're reaching the goal of the activity, not just spending some time online. And adjust for that online activities might take longer time than in person. So we have to make sure that to give extra time for our learners to do that. And make use of whatever the online environment give you. If you're using Zoom, use polls, like, you know, the question polls, use all these emojis, activities in your interaction. So 10 tips for facilitation. Again, be prepared, not on the subject topic matter per se, but be prepared to role model collaboration. Okay, we always have to practice what we preach. So be prepared to role model collaboration. Invest in the beginning. So spend some time for everyone to introduce themselves, their role, and explain what they can do. And create, again, a safe and open environment. Emphasize that everyone can express their opinion. Everyone should be heard or will be heard, and all opinions matter. Again, be a role model. That's very important, and that's very important generally for healthcare professionals to be role models, right? Monitor the situation. Watch body language. Watch how the interaction is going. Is somebody overbearing over the others? Is somebody making, oh, this is what we're going to do and that's it? How to deal with that? So you have to interfere and redirect as needed. Maintain neutrality and sensitivity. Again, regarding any biases you have and regarding disciplines. All disciplines are equal. That's one thing you have to work on. And then at the end, you need to reflect and summarize on the group activity. So again, IPE activity is a learning continuum. Start in school and should continue after you graduate. There's a lot of assessment tools out there. I know we have heard earlier about assessment tools, but there's a lot of assessment tools. Like there is the ICAR, ICAS, and there's a couple of others. And you can pick the one that mostly represents your activity and use it. But every activity needs to be assessed. Okay. So how to include what culture and diversity, how can affect my facilitation or activities. So remember, we have a group of learners, different backgrounds, different disciplines. So not just different culture, differently everything. Culture can affect, first of all, the interaction between the learners. Some of them might be shy because of accent or because of any other issues, not because they don't know. And also, we have to be open with everyone, right? Actually, having culture diversity in your group does help the learning activity. It doesn't hinder it, but you have to know how to direct the learners to make use of that because they have more maybe of a rich background on some other stuff. So again, culture differences can impact your group dynamics, can impact how you should facilitate, but you need to be open, flexible, and non-judgmental, and you can always encourage your learners to use the ODIS, again, if challenges because of culture arise. And the ODIS, again, they observe, you know, stop, see what's going on. They describe the situation that happened without interpretation, just neutral. Then they can sit down together and try to interpret what happened with different explanations. And then they can suspend their judgment, okay, and acknowledge, oh, some other people might think differently, might act on it differently. So that's kind of to ensure that including culture, diversity, everybody's heard and everybody is respected, and that's a key. So the take-home messages today is, again, facilitation is different from teaching, right? And here in the College of Health, we have been doing a lot of IP activities, and every time we have different group of learners, so we never keep the same IPE teams. Now it's always advisable to keep the same IPE team. So if we are thinking maybe of an IPE course, it's mandatory for all of the College of Health students. It's really best to keep the IPE team because that gives them the chance to go through the team formation, like the forming, storming. There's like a team formation process. But if you see each other one time, one activity for 2 hours, there's no really actual team formation. Again, we should always practice what we preach. So we should use team briefs, debriefs, and huddles every time before, during, and after an activity that we do. And that's for the learners and facilitators or the IPE planners. And any questions? Okay, thank you. And I think I'm on time, right? Thank you. And sorry for the